Hello everyone and welcome to another episode of Ask Dr. Bob. We're going to give you some very good answers today for some very tremendous questions. Dr. Bob, I have Crohn's disease and then I was also diagnosed with atrial fibrillation. They wanted me to go on a drug and they want me to take an aspirin every day. Wanted to know what to do. Here's what's an interesting thought. We have a piece of equipment in the room I'm standing at right now called the acoustic cardiogram. And that's a tool that we use to assess the mechanical sounds or the audible sounds, and we translate it to mechanical energy so we can look at a graph of a person's body. We have found individuals who do not have enough minerals, this is really important, could have altered function of the heart. So it's very possible that your Crohn's could be interrupting mineral absorption. So I'm not going to tell you to go off the drugs. I would definitely take a liquid multiple vitamin, and I would probably try to get a liquid mineral. Also, or ones that you could put on top of your tongue, because you want that to be absorbed directly into your body. That was a tremendous question, by the way. We had another individual sent me their blood test results for the thyroid, and I typically don't like to answer specifics, but this is something that's important. They wanted to know what their thyroid condition was. Well, first, their TSH level went from 0.3 to 4.0. That's the reference range, 0.3 to 4.0. This person had 7.48 for the TSH. That would suggest someone having subpar thyroid function. They also had a high T3. 6.5 is the high range. It went from 3.5 to 6.5, and they're at 6.5. Now here's what's interesting. When I see markers like that, because this person did not tell me if they were taking any medications or not. So I have noticed, especially if you're doing an Armour thyroid, your T3 could be elevated. Their T4, on the other hand, the range was from 9 to 23, was 18. So the T4 was normal, their T3 was high, and the TSH was on the higher end. Typical pattern for a low thyroid, the T3 skews it. So this thyroid could be quite an interesting challenge for that individual. Maybe you might want to contact us. Dr. Bob, I have a question. I was in the store today and I was looking at Himalayan salt and I noticed it had no iodine, and they were surprised by that. So I want you to know that Himalayan salt has less than 100 micrograms per gram of Himalayan salt. And I also want you to know that Celtic sea salt usually has 0.68 parts per million of iodine in the product itself. So that was quite an interesting tidbit for you to know. Are there any side effects from Livitrate, which happens to be a proprietary herb from Biotics Research Corporation? It could create some discomfort in your mid-back region and maybe some digestive distress, because Livitrate is an herb that promotes optimal liver function. So yes, it could be an issue. We also would suggest maybe a product called Beta Plus, which is bile salts, and Beta TCP, which thins the bile. Dr. Bob, I have a problem with heavy leg syndrome. I'm 68 years old and I have belly fat. Well, the heavy leg syndrome, that's kind of a new term to me. So there's all kinds of wonderful terms that individuals use. A lot of times when people have heavy legs, it's usually their bodies need minerals. I would even maybe consider soaking in an Epsom salt bath. I would bounce on the ball. Obviously you want to get rid of the belly fat, but I think if you bounced on the ball and got some exercise going, that would help you a lot. Tremendous questions, and I know this will make a difference in your life. I'm Dr. Bob DeMaria, the Drugless Doctor.